If you're allergic to bees, peanuts, penicillin, or really anything, this is something you're going to want to hear. Today, we're going to talk about anaphylaxis, a type 1 hypersensitivity reaction. Let's learn some pathophysiology. In most cases, to have an allergy, you must first be sensitized to the offending antigen. Let's talk about how that happens. So over here we have our Th2 cells, which work in conjunction with an interleukin, here that's interleukin 4, and they'll stimulate and they'll kind of meet up with a naive B cell. Now what will happen is this will stimulate class switching of the naive B cell to produce something called IgE. This IgE is going to associate with the surface of mast cells that are going to cause the type 1 hypersensitivity. Now this is something you're going to want to pay attention to because this is high yield. Over here we have our mast cells, right? Our mast cells are just kind of chilling out in our tissues, and then they come in contact with an antigen, or in this case this would be your allergen. This allergen is going to bind to the domain on the IgE immunoglobulin that is found on the surface of the mast cell. This is going to simulate some cross-linking, and it's going to cause degranulation of the mast cell, and it's going to release the contents of its granules, including a very important molecule called histamine. Histamine and other inflammatory mediators are going to induce bronchospasm, so the bronchioles within your lungs are going to kind of constrict. This will make breathing a lot more difficult. They will also cause peripheral vasodilation. This will cause some hypotension or low blood pressure and increased vascular permeability. It's also, of course, going to cause a lot of itching and hives. This is something normal that we see with the release of histamine, especially with the increased vascular permeability, which is going to lead to some erythema or red skin. Lastly, with this inflammation and increased permeability of your vessels, you're going to get a fluid extravasation into the interstitial space. And this is going to cause some edema or swelling. That's why you might get kind of puffy lips, puffy eyes, or really puffy anywhere. When a type 1 hypersensitivity reaction is severe enough, we call this anaphylaxis. Now, anaphylaxis is a very dangerous and life-threatening condition, but it's completely treatable. I hope you enjoyed learning about hypersensitivities. See you next time.